If you have it, you may have tried all the creams, or maybe you've just given up the battle and you no longer wear shorts any longer. And we are talking about Cellulite. Now there's a new procedure that promises to get rid of the dimples for good. I'm so excited. Plastic surgeon Dr. Dan Shapiro is here, along with his patient, Brianna Haddocky, to tell us more about it. And I'll tell you, a lot of women are frustrated with this subject, and we've tried everything. And now there's this new procedure called Cellulaze.
Cellulaze. You know, I've been in practice for 20 years, and sure enough, I've always dreamed of being able to help patients who complain about cellulite. And it's a tough problem. 90 to 95% of women are going to have it. And up until now, I haven't been able to do anything consistently that gives, long-lasting results that people are happy with. I think it's a tough problem because, I think people are tough on themselves, but at the same time, if you have it, you have it, and there's nothing to really do about it. And chances are, if you don't have it, you're going to get it. And basically, there are anatomic reasons of why people have cellulite, and nothing before Cellulaze, which is actually the first FDA-approved treatment for cellulite, nothing before has been able to anatomically address what causes cellulite.
And Cellulaze is a procedure that only you have right now in the state of Arizona, right?
Right now in Arizona, I'm the only person that does it. And basically what it does is I put a little laser cannula beneath the skin, and I use that laser to treat really the three main things that cause cellulite. The first thing is the bulges that you see, and that is fat that's herniating or pushing up through the skin. The second thing are the dimples that you see in the skin, and basically that is from connective tissue that is pulling down, causing that mattressing effect. And the laser really is the first treatment that is able to consistently release those dimples so you get a smooth surface. And the last thing I do with the Cellulaze laser is I use that laser to tighten up the undersurface of the skin. So all three of those things together are what contribute to things that you hate and everybody else hates.
I see. So this is really cutting edge. I mean, this is better than anything else, because it sounds like you're really getting into the skin and correcting that.
You're addressing actually what's going on. And the beauty of it is it's performed in my office under some mild sedation. It takes me about an hour, hour and a half to do both thighs, if you will. The most common areas that I would do would be the back of the thighs. I've done the front of the thighs, I've done the side of the thighs, above the knees. All of that can be done in the office, and then basically you go home and wear what looks like a compressive garment, a liposuction garment, for about 3 weeks.
And then when do you start seeing results?
I say you start seeing the results within about 3 to 4 weeks, and then you really don't see the majority of what I've done for up to 4 to 6 months or so.
Okay, so let's look at some before and afters, and we're going to talk with Brianna real quick. I'm dying to ask Brianna. So here is typical what so many of us go through. Wow.
And what you're seeing here, and this is after 6 months, and you're seeing on the left, you're seeing the dimpling that really bothers people, and you're seeing the bulges, the dimples, and the skin laxity. And on the right is that beautiful result after 6 months. You're seeing much smoother skin. And it really is liberating for people, because all of a sudden you don't have to forego that pool party or not be concerned about wearing shorts when you're golfing and things like that. So it's really a great thing. These are more pictures after 6 months. That big dimple on the left is alleviated by the Cellulaze, and you're seeing much smoother skin. And actually this gets better over time. These are some results at about a year, year and a half, and you're seeing much smoother skin on that lateral thigh, which is the most common area that I'll do. And this is, when you're talking about somebody that has overall a good physique, but just some cellulite, it's the skin laxity, it's that mattressing that you see. And up until now, nothing has consistently dealt with that other than Cellulaze. So it's really a beautiful treatment.
And it's nice because it even gets better the longer it goes.
It does. It gets better. And the last slide here is really at 3 years, and that's the result. These are actually pictures of Brianna before I did the procedure, and you can see how I mark the area and the different colors. The green are the bulges, and the red is actually the dimpling. And I'm going to use that laser, kind of that's a roadmap for me, to release the specific things that are bothering her.
I've got to ask you, Brianna, so what was the treatment like?
It was literally painless, and it lasted about an hour. It was really easy. I just laid on my stomach, and I was awake the whole time.
And how long ago did you have it done?
About 4 months.
So
beginning
you've
of the
now
year.
seen the results.
Yes, definitely seen results, and it's still healing, so it's just going to get better.
So what has it, because I can kind of relate, so how has it helped you? Like, I mean, we get 100 and something degree temperatures in the summer, and I find I'm always looking for things to hide my thighs.
Exactly.
Has it changed things for you?
A little bit so far now that it's starting to get warmer.
Yes.
It's a lot more freedom, I think, in your mind for sure, just because I always was covering up too. And so now this is kind of a chance where I don't have to worry about that so much.
Did you try everything else before, creams and all that stuff,
Yeah.
and nothing really worked,
Yeah,
right?
yeah. When I heard this solution, and
Right.
like you said, it just seems like it's more of a permanent solution, and I'm so glad I did it.
Yeah, I'm sure you're very happy with your legs, because I mean, when we wear skirts and so forth, you see all that stuff.
It is,
Yeah,
and like Brianna, I've had so many patients now that can change their wardrobe per se, and you know, maybe they don't want to wear a string bikini, but at least they feel they can wear a bathing suit now and not feel self-conscious about it, and it really has put a huge spring in their step in terms of their confidence and their well-being.
Yeah, I love it.
Yeah.
There is a great event happening too on May 9th for all of you out there who really want to learn more about this event. It's happening May 9th. You will kind of go through the whole procedure,
I will.
how it works,
Exactly.
give them a kind of
and there's some other
information.
things, you know, skincare and sunscreen, and there are some varying types of liposuction, et cetera, et cetera. All these things that I think can prepare people for the summer months when you're going to be wearing less clothes.
I love it. And they've got a great goodie bag, too, that you can be part of.
We do.
Thank you, Dr. Shapiro.
My pleasure.
Thank you, Brianna, for coming on and sharing your story. Congratulations to you, too. That's awesome. Now, if you would like more information about Cellulaze and Dr. Dan Shapiro, you can always go to his website. It's ShapiroPlasticSurgery.com. It's the Shapiro Plastic Surgery and Skin Clinic. And there is the phone number right there on your screen.